So I remember the first time we did an experiential group training here in Minnesota. It was in the fall of 2019, and we had a small group of people. There were about 20 of us total, and we split into two groups of 10, and I was leading a group of 10. And we were in a room, in a circle, doing small group work together, engaging with the here and now dynamics of what was playing out in between us. And there was a woman there who was sitting quietly. I think she maybe had her arms folded and had kind of a blank expression on her face. And of course, after a while, the group started to get curious about what was going on for her. And I know that I had the assumption that she probably wasn't enjoying herself, that this wasn't what she thought it was. But what she said, I think, surprised all of us. She said something to the effect of, "I've been waiting for this kind of training for 30 years. And she went on to explain that this was something very meaningful to her, and she was very excited to see that we were doing this, and she could see how this would be very helpful for, of course, current professionals in Minnesota, but also in the future for students that are wanting to learn, how do you do group work? How do you do group therapy? And so that's the experience that a lot of people have. I think it is, of course, pretty anxiety provoking. If you've never done a training like this, it is anxiety provoking, and you can empathize with what clients might feel as they prepare to join a group. And so that anxiety is a very central piece to joining any group experience like this. And so the training that we do, if you have done like a training with the American Group Psychotherapy Association, AGPA, maybe one of their institutes, then you know exactly what it is that we do in these conferences. Or if you've done one of the affiliates, I've gone to Northern California and the LA one, I've gone to Texas, I've gone to Denver for their Four Corners Group Psychotherapy Association, I've been to Washington, D.C., and of course to Illinois a number of times. So this is something that a lot of people do, and it's a chance to really get together with other clinicians and engage in real small group work together. It's not therapy, of course, it's training, but it does bring up a lot of the same feelings, the same dynamics that can come up in any group. So how do I practice really revealing myself to the group as much as I want to? How do we engage in conference when there's diversity, when there's difference, when there's people that have different ways of thinking? How do we do that in a way that can create cohesion? And so it's a very powerful experience, and probably one of the best training experiences that you can have. And so there will be some didactic pieces, some of that where you kind of sit and you take notes and you take in information. But a lot of the conference is that active participation where you get to engage and do it in a way that you'll benefit yourself. You'll have corrective experiences yourself, and will definitely benefit your individual therapy, of course your group therapy, any couples or family or other work that you do. If you have any questions about what this conference is like, or if you'd want to sign up or not, please reach out to me, and I'd be happy to answer any questions, or reach out to a friend or someone who has done some group experiential training like this. Really hope to see you join us for this conference, and if it's not a good fit, then maybe we'll see you for a future conference. Thanks so much.